If you have keratoconus and wear contact lenses, proper lens care is not just a routine, it's a critical part of your treatment. Keratoconus causes thinning and irregularity of the cornea, making your eyes more vulnerable to irritation, infection, and inflammation. That's why maintaining strict hygiene with your contact lenses is essential for both comfort and long-term eye health. Let's go step by step. Always begin by washing your hands thoroughly with soap and water and dry them with a lint-free towel. This reduces the risk of transferring bacteria onto your lenses. Next, use only the cleaning solution recommended by your eye care professional. Never use tap water or saliva, as they can introduce harmful microorganisms. Even if your solution is labeled no rub, gently rubbing the lenses during cleaning helps remove protein deposits and debris more effectively. This is especially important in keratoconus patients for maintaining clear vision. For those using scleral lenses, proper handling is equally important. Always fill the lens with preservative-free sterile saline before insertion, ensuring there are no air bubbles trapped inside, as this can affect both comfort and vision. Your lens case should also be cleaned daily and replaced regularly, as it can become a source of contamination over time. Finally, always follow your prescribed wearing schedule and attend regular follow-ups with your optometrist. Take care of your lenses, and you take care of your vision.
Click, clack, bullet. Click, 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 click. Go!